My name is Riley Gordon. This will be my head-to-toe assessment for the Women's Health Clinical of Summer 2024. Today's date is May 28th, 2024. This is the room, and the ceiling, the floors, the walls. These will be my tools for today's assessment. I will start my time and begin my assessment now. I will assess the skin throughout the assessment of the head, neck, face, anterior chest, posterior chest, and abdomen. I'll be assessing for skin color, texture, turgor, temperature, moisture, neti, scars, lesions, bruising, and edema. I'm going to be, I'll assess the head for midline position, size, symmetry. I'm going to assess the head and palpate it for hair color, hair texture, hair distribution, any masses, depressions, lesions, and tenderness or infestations. I'm going to palpate the temporal arteries for any tenderness. I'm going to palpate the lymph nodes of the head, starting with the occipital, postauricular, preauricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. I'm going to palpate T and J. Go ahead and open your mouth and close for any crepitus, tenderness, or subluxation. I'm going to assess cranial nerve 5, starting with the motor and palpate the masseter muscle, clench your jaw. I'm going to also do the sensory part of cranial nerve 5 with light touch. Close your eyes. Tell me when you feel this.
Feel it.
Forehead.
Feel it.
Nose.
Feel it. Feel it.
Cheeks.
Feel it.
Chin. I'm going to now assess the ears for position, symmetry, shape. I'm going to palpate the pinna for any and tragus for any masses or tenderness. I'm going to inspect the auditory canal for inspect the auditory canal and tympanic membrane with my otoscope, pulling the ear up and back. Same thing on this side, up and back. And then I'm going to assess cranial nerve 8, assess for hearing, starting with the whisper test. Cover your left ear for me. Repeat after me. 1, 2, 3.
1, 2, 3.
And then cover your right ear for me and repeat after me. 1, 2, 3. 1, 2, 3. All right. I'm going to do Weber's test. Looking for lateralization. Can you hear that equally in both ears?
Yes.
And then I'm going to do the Ryan's test. Starting with bone conduction. Tell me when you can no longer hear that.
No.
And then moving on to air conduction. Tell me we can no longer hear that.
No.
And do the same thing on the other side. And we want bone conduction to be longer than air conduction.
No. No.
All right. I'm going to assess and inspect the brows, palpable fissures, and lashes. I'm going to inspect the conjunctiva and sclera for color, discharge, and lesions. I'm going to assess cranial nerve 2 for gross visual acuity and peripheral and central vision. So go ahead and read the lowest line with both eyes.
EPTZO.
Cover your right eye, repeat.
DHJBS.
And cover your other eye, your left eye.
OLCF.
All right, and then now doing peripheral and central vision. Go ahead and tell me, look straight ahead and tell me when you see my fingers.
No.
All right, and then it says cranial nerve 3 for pupillary, direct and consensual pupillary response to light. Look straight ahead for me, looking for pupil constriction. And then we'll look for, I'm going to assess for convergence and accommodation. Go ahead and look at this and follow it in. Perfect. I'm going to assess cranial nerve 3, 4, and 6 for conjugate gaze and any extraocular movements. Go ahead and follow my finger for me. All right, and then we'll assess red reflex and other internal eye structures such as the optic disc Using my right eye to assess his right eye. Using my left eye to assess his left eye. Okay. I'm going to move on to the nose. I'm going to inspect for midline and straight. I'm going to inspect for nasal patency. Plug one nostril and blow, and then one nostril and blow. All right. I'm going to assess cranial nerve 1. Sense of smell. Close your eyes. Tell me what you smell.
Vanilla. Strawberry.
Perfect. I'm going to palpate the frontal sinuses and the maxillary sinuses. I'm going to now assess your mouth and throat, starting by assessing your lips and your open up all the way, teeth, gums, tongue, buccal mucosa, salivary ducts, floor of your mouth. Raise your tongue for me. Your palate, your posterior pharynx, and also your tonsils, which are 2+. We're going to assess cranial nerve 9 and 10 for soft soft palate and symmetrical uvular rise. On phonation, open your mouth and say ah. All right, and then we'll look for midline, assess cranial nerve 12 for midline tongue with no fasciculation. Stick your tongue out for me. Perfect. And then I'm going to assess the neck, starting off by palpating the trachea, make sure it's midline. And then we'll palpate the thyroid, turn your head and swallow the other way. Perfect. I'm going to auscultate. Well, first I'm going to palpate your carotid pulse and carotid artery, both sides. And then I'm going to auscultate them with the bell. For any breweries, turn your head and hold your breath. Okay, other side, hold your breath. Okay. I'm going to now assess your posterior chest, if you don't mind turning around for me. I'm going to inspect for any obvious deformities. I'm looking for symmetry. I'm going to assess for any obvious signs of respiratory distress, such as tripoding, nasal flaring, use of accessory muscles, retractions, cyanosis, tachypnea. I'm going to palpate for symmetrical chest expansion. Go ahead and take a deep breath in. Perfect. I'm going to palpate for symmetrical tactile firmness. So repeat 99.
99, 99, 99, 99.
All right. I'm going to percuss in intercostal spaces, starting above the scapula, going side to side and down to get the lung fields. All right. I'm going to now auscultate the lung fields, same locations, above the scapula, intercostal space with my diaphragm. Making sure to go side to side and down. And making sure to get laterally for that right middle lobe. I'm going to now auscultate again for bronchophony. Go ahead and repeat 99 for me, then listen.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
All right, and we're going to do egophony. Go ahead and hold E for me.
B.
All right, and then we're going to whisper pentarotically. Whisper 1, 2, 3 for me.
1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2. Okay, you can go ahead and turn around for me. We're going to assess the anterior chest, looking for any signs of deformity, symmetry. I'm going to palpate for symmetrical chest expansion. Go ahead and take a deep breath. Perfect. I'm going to palpate for tactile firmatives. Go ahead and say 99.
99, 99, 99, 99.
All right. I'm going to now auscultate again with the lung fields, make sure we intercostal spaces. Okay. Now you can go ahead and I'm actually going to listen to your heart tones, starting off with my bell. Going to listen to the aortic, starting in the second intercostal space right of the sternal border. Pulmonic, it's the second intercostal space left of the sternal border. Herbs, it's the third intercostal space left of the sternal border. Tricuspid, it's the fourth intercostal space left of the sternal border. And the mitral, which is the fifth intercostal space mid-clavicular line. This is the same location as the PMI, so I'm going to palpate it. I'm going to listen to the same locations again with my bell. Okay, I'm going to now listen for your apical pulse at the location of your PMI for 1 minute. Your heart rate is 80 for the regular rhythm. You can go ahead and lean back for me. We're at a 45-degree angle. I'm assessing for JVD and jugular pulsations. Turn your head for me and turn your head this way towards me. All right, we're going to lay you flat. Legs, perfect. I'm going to inspect for any heaves or lifts, and then I'm going to palpate in the same auscultation points of the heart for any thrills. And then I'm now going to auscultate again with them laying flat, starting with my diaphragm, same locations. Okay, and then repeat with my bell. I'm going to now assess the abdomen for contour, shape. I'm going to auscultate for any bruise with my bell, starting with the aorta, renal arteries, iliac arteries, and femoral arteries. Then I'm going to auscultate bowel sounds, starting in the right lower quadrant with my diaphragm, right upper quadrant, left upper quadrant, left lower quadrant. I'm going to now percuss in the same quadrants for any tympany, fullness, or flatness. I'm going to palpate for any masses, tenderness in the same quadrants. I'm going to you can go ahead actually and now sit up for me, and I'm going to percuss for CVA tenderness. All right, you can go ahead and come all back up front to me. I'm going to now assess the joints of the hands and palpate them, the elbows and the shoulders and the wrists. I'm going to palpate capillary refills of the fingers, palpate radial pulses. I'm going to assess Range of motion, so your fingers starting your extension, flexion, hyperextension, abduct, adduct, thumb opposition. All right. I'm going to assess range of motion of the wrist, so your extension, flexion, hyperextension, radial deviation, ulnar deviation, rotation. I'm going to do assess the range of motion of the elbows, so you're at extension, flexion, hyperextension. Range of motion of the shoulders, so you're at you're at extension, flexion, hyperextension, abduct, adduct, and circumduction. And then you're going to do internal rotation and external rotation. Okay. And then we're going to do strength of the hands. Go ahead and squeeze my fingers, 5 out of 5. Strength of the biceps, pull up, 5 out of 5. Push down for triceps. Nope, like this. Do that for me. There you go, 5 out of 5. And then strength of the shoulders, so straight out, push down, 5 out of 5. Push up, 5 out of 5. Strength of the shoulder girdle, so this is cranial nerve 11. Push up, 5 out of 5. I'm going to assess steriginosis and craphesthesia, starting with steriginosis. Hands out, close your eyes, tell me what you feel.
A coin.
And tell me what you feel.
Paperclip.
And then you're going to do craphesthesia, same thing, hands out, eyes closed, tell me what I draw.
Circle. Circle.
Okay. Then we're going to do light touch sensation of the upper and lower extremities. Keep your eyes closed for me. Tell me when you feel it.
Feel.
Okay. I'm going to do, we're going to test cerebellar coordination with rapid alternating movements, starting with serial finger opposition. Do this for me. And then hand flip flop, start slow and then speed up. And then we're going to do finger to finger, so touch your nose and touch my finger. Other hand as well. Okay. And then you're going to do, we're going to assess the skin of the upper and lower extremities for warmth, skin integrity, edema, and color. I'm going to assess vibratory sensation of the proximal ulnar prominence. Tell me if you can feel that.
Yes.
And that one.
Yes.
And then of the medial malleolus.
Yes.
Both sides.
Yes.
All right. I'm going to assess deep tendon reflexes, starting with the brachioradialis, and then bicep, tricep. Same thing on both sides. And then I'm going to do the patellar tendon, and then Achilles, and then the Babinski. Okay. I'm going to assess the joints of the toes, ankles, and palpatum, and of the knees and of the hips. I'm going to palpate capillary refill of the toes, do the dorsalis pedis, palpate those, and palpate posterior tibial pulses. I'm going to do the range of motion of the toes, so you're at extension, flexion, hyperextension, abduct, adduct. Then we're going to do the range of motion of the ankles. You're at do dorsiflex up, plantar flex down, both legs. There you go. Inversion and eversion, and then rotation, both of them. Perfect. We're going to do the strength of your ankles. So dorsiflex down, plantar flex down, sorry. Dorsiflex up, 5 out of 5 for both. Strength of the knees, so kick out for me, 5 out of 5. Pull in, 5 out of 5. Strength of the hips, push in, 5 out of 5. Push out, 5 out of 5. Go ahead and stand up for me. We're going to do range of motion of the knee. So you're at extension. Go ahead and do flexion, hyperextension. Same thing for the other leg. That's flexion, extension, and hyperextension. Then you're going to do, we're going to assess the range of motion of the hips. So you're at extension, so then flexion, hyperextension, perfect. You got both legs, perfect. And then we're going to do abduct, both legs, then adduct, and then internal rotation, both legs, and then external rotation, and then circumduction, both legs, perfect. And then we're going to do this range of motion of the lumbar spine. You're at extension, so flexion, back up, hyperextension, lateral flexion, both sides, lateral flex, and then rotation. And then range of motion of the cervical spine. So you're at extension, flexion, hyperextension, rotation, and then lateral flexion. Okay, and then turn around for me. I'm going to assess the spine. Go ahead and bend forward for me. For any normal curvature, alignment, any scoliosis. Keep bending over for me, please. Thank you. And then you can go ahead and stand back up for me. Turn around. We're going to assess gait. Go ahead and take normal steps forward, please. And then turn around and then do tandem for me. So heel to toe. Perfect. Thank you. We're going to do assess Romberg. So close your eyes and stand still, looking for any swaying. And then I'm going to assess for you to hop on one leg if you feel safe, and the other leg as well. Let me just think for a